Welcome, everyone, and thank you for joining the ISG Smart Talk, Top 10 Emerging Healthcare Trends in the New Future. This ISG Smart Talk is being recorded, and the replay will be available to share with your colleagues at the same link as the live event you're listening to now. Feel free to submit a question at any time during the presentation by using the Ask a Question box on the left side of your window. If we don't get to your question during the webinar, or if you're listening to a recording of this broadcast, we'll answer your questions in a follow-up email. With that, I will hand things off to Bob Cron to kick off today's ISG Smart Talk.
Thank you so much, Jillian, and welcome to the audience today. We're very glad that you're able to join us. Before I get started with an introduction, I would like to let everybody know that we're going to try to make this as interactive as we possibly can for this webcast type environment. So along the way, there will be two different poll questions where we'll survey the audience today, and we will get some feedback from what it is that you're thinking. So we encourage you to participate in that feedback and help us guide the conversation as we go forward. At the end of the webcast today, we've set aside 15 minutes for Q&A. We look forward to managing as many questions as we possibly can in that time frame. So as means of introduction, my name is Bob Cron, and I head up the healthcare practice for ISG. What that entails is overseeing our go-to-market strategy and delivery across the healthcare sector, which ISG defines as payers, providers, and healthcare solution providers. We have a different part of our firm that focuses on life sciences. So today we'll be talking about those three market segments of payers, providers, and healthcare solution providers. I've been with ISG for 10 years. I've been in this role for 5. With me today, I have 2 colleagues and invite Jamie Burke to introduce himself.
Hello all, Jamie Burke here. Look forward to speaking with you today. My background includes 15 plus years in working with systems integrators, and here with ISG for close to 6 years working with major payers and providers, helping them execute major sourcing transformations and digital transformations. Tony?
Tony Mattia. I'm a director in the healthcare practice with Jamie and Bob, and my background is technical advisory and consulting for the last over 20 years. And I work closely with strategic clients in the healthcare space as well as responsible for geographic regions of the U.S.
So before we get into today's content, I'd like to introduce everybody to our Healthcare Resource Center. You can see the URL there, and it is our landing page, if you will, for healthcare content. Both Jamie, Tony, and I all publish routinely articles and artifacts onto this resource center. And most recently, we're proud of 3 specific additions to this webpage. So we all jointly collaborated on something called What We Can Expect from the Healthcare Industry. Jamie and I were pleased to participate in a podcast, so we invite you to click on our landing page and listen to that. We tried to take an entertaining approach to what we're seeing in a post-COVID-19 environment, and we have a deeper dive that I helped co-author entitled Unlocking Value with Intelligent Automation. So look at what we're doing in the payer space with intelligent automation. We routinely publish and invite you guys to access that resource at any time. So getting into today's content, you probably would expect us to start with the current state, and we will spend some time on discussing what we have seen with the immediate crisis. So we'll talk about elements of remote work, working from anywhere is how ISG likes to term it, business continuity, supply chain resilience, and continuous patient member client services. I'm going to turn it over to Tony, who'll give us a little bit more industry flavor from a payer perspective.
Yes, if you think about it from a payer perspective, COVID most of the people really were in an office environment, and that became even more important as teamwork and agile type activities are going on. And making that adjustment to working from home was a huge undertaking. In addition to that, you had offshore and nearshore resources that also are going through that transition at the same time. Simultaneously with that, you had a significant uptick in volumes to contact centers, for example, as members were trying to find out what the status was and what the situation was, and that caused a significant overflow into looking for more capacity to handle that. And I'm sure all of you probably experienced long wait times when you're trying to call in. So that was a significant impact. And then just dealing with the application limitations and a lot of legacy systems requiring rapid change and rapid regulatory change really impacted the payers.
Jamie, what are we seeing from our provider clients?
Absolutely. So probably about every hour on the television, you're seeing the actual battle be fought, right? We're seeing pictures from some of the hot spots in the country and situations that they're dealing with, not only the medical fight, right, but the supply chain resiliency with PPE or ventilating machines and you name it. Other parts of the country, right, are for the provider community are going out of business. So they're having to shift resources around. They are as well trying to figure out to make sure if a surge or the disease finds its way to their part of the country that they have enough stuff going on. So it's all of the map depending upon where you are in the country, and then obviously, right, is there going to be a resurge? So a lot of these things are in different states of maturity in regards to what folks are handling. Bob?
So as we move forward to what ISG calls the road to resiliency, we see several steps along the way. So what you're viewing now is more of an industry agnostic perspective. So regardless of the industry, we see these particular 5 stages emerging with our migration into what ISG is dubbing the new future. And depending upon the industry, the timing of these stages goes at a different rate. So when we think about healthcare and emergency preparedness, the industry as a whole going into COVID-19 thought that we were really prepared, right? Everybody thought that their emergency preparedness plans was ready for anything and that they were going to move forward with their plans in a seamless way. So what happened? The COVID-19 hit. It hit different parts of the country at different times, and we found that our emergency preparedness plans weren't as robust as we had hoped. This was specifically true in the provider part of the industry, where obviously the hospitals are on the front lines and they're facing challenges every day. Some of those challenges have waned in certain parts of the country now, but everybody's had their time where the emergency preparedness plans were tested to their fullest, and in some areas they just didn't come up to fruition. The payer part of the market segment's been a little bit more stable as we see it than the provider side. Certainly there's been increased volumes. Call centers have been a little bit overwhelmed, but they've managed to move through this a little bit with a little bit less disruption than we have seen in the provider space. We're starting to move into survive mode, and now we're starting to see some interesting things, and this is obviously affecting all 3 market segments of payer providers and healthcare solution providers. It's becoming common knowledge, everybody sees the stories on the news, that even the provider space is starting to struggle with survival. They're seeing cost-cutting exercises come to fruition on a very rapid basis in all parts of the country. There's well-publicized stories on hospitals that are doing cost-cutting measures that they've never seen before. From an outsider's perspective, it seems a little odd that would be the case in the provider space, but it's certainly coming to fruition. In the next part of our hour together, we're going to focus more on what we've dubbed Horizon 1, Horizon 2, and Horizon 3. So it's not my intention to steal the thunder of the rest of the presentation on those particular phases of the recovery. we'll drill into those in more detail as we go along. But before we do, we'd like to have our first poll question and understand from you what we're seeing in the market and where you are in your recovery journey. So Jillian, will you launch the poll question for us, please?
Absolutely. I just sent that to the audience, and everyone should hear an alert when that pops up on your screen. Our first question today is, where are you or the majority of your clients on the recovery journey?
We're really interested in seeing what these responses are. Tony, Jamie, and I have kind of been talking about it, saying, where do we think our audience will land? But it's kind of interesting to see what it is that you actually say. I don't want to presuppose for your benefit as you go through this voting, but be interesting to see. Are you more along just starting off in emergency preparedness? Have you moved on to survive? Some of you starting to prepare for the new future? For the service providers on the call, obviously respond in the voice of what you're seeing from your clients.
All right, we'll give everyone just a few more seconds to answer, and I'll send the results to the audience. Bob, would you like to speak to these results?
So for some reason, I'm not seeing the results.
So I can chime in, Bob.
Thanks, Tony.
One thing that surprises me is, probably that about 22%, 23% are in the prepare for the new future. That's even higher than I thought. I didn't think that, but that's great that people are already thinking along those lines, and it'd be great for the rest of the presentation. And then, I think about 65% being in both the survive and recover mode is probably closer to what we were thinking. Still 25 in survive mode's a little scary, but it's realistic, and I think it's great that you guys are giving us that feedback. And there's just a small amount in not sure. So that makes sense, and it tracks pretty close to what we were thinking. I don't know, Bob or Jamie, any thoughts?
Yeah, it makes sense. I think what's good is that our further comments in this webinar will address each one of those stages. So it's great. Yeah, no, this makes a lot of sense. This is kind of what we've been thinking has been happening, and as we talk to our clients. So along those lines, Jamie Burke here, along those lines, in the past, all right, you've had a healthcare operating model that was incredibly focused and patient-centric, right? And it's changing, obviously, right? It's changing, over the last handful of months, but then needs to change moving into the future. You've heard about digital transformation, right? And we're actually seeing some of the digital transformation play out well with some of the services that are available to folks. And I'll tell a story about my own personal digital transformation healthcare story here just the other day. But this op model, this new healthcare operating model, right? Previously, it was very, very patient-centric, and whenever you heard the term digital transformation, you would hear, oh, okay, let's improve engagement, let's improve innovation and efficiency, let's, increase our ability to scale. Well, now the operating model obviously is focused on not only patient centricity, but also resiliency. And we'll talk to more about that as the presentation goes along. But there's also a couple of themes here that are becoming incredibly clear, right? Critical process continuity is just incredibly important, right? We're seeing all sorts of process breakdowns throughout the country in various different industries, never mind healthcare. Assume working from anywhere, right? Previously, we kind of shied away from that, right? We now have a new normal or new future here in regards to, heck, probably 95% of us, 98% of us are right now working from home. And when you build resiliency, right, it's not only your own resiliency, but it's also the ecosystem resiliency. Really check into and make sure that, right, your ecosystem of partners and providers are as resilient as you are. And if not, have a plan A or B, right? And then finally, the design for new customer preferences. Again, I'll tell you another story about how I was able to engage with the doctor here virtually, and it was fantastic, right? And it was very timely. So these 4 themes, right, you'll see they're clearly showing themselves right now. And then the new operating model, right, is not only, patient, 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 but now it's patient centricity and resiliency. Bob, Tony, any other comments?
Yeah, the only thing I would add is that patient centricity has always been foremost for the healthcare payers and providers. It's always been the theme. But what we're seeing now is really the disruption of COVID-19 is making it even more so. So it's taking us to a new level of intimacy. And as we move along into this operating model, we're going to see more and more demands from the patients and the members to make sure that the centricity is in place in the form of new applications, new ways of doing business. So it really has been a disruption.
So I'm going to talk about recover and resolve, and most of you were in that in those sections. So we, as Bob said, we call it Horizon 1. All of you are probably sick of hearing about flattening the curve, right? But it was key from a perspective of making sure that the provider resources and hospitals, et cetera, were not overrun. That was primary concern. So as we move into recover and resolve, I'll look at it from the payer, the provider, and the solution provider perspective. First of all, I already talked about work at home, and we're talking about work from anywhere. As we move through this phase, as places open up where you can go work, we're pretty much limited to home, but as things open up, then you'll see more and more people working from anywhere, and that brings a lot of security issues, a lot of bandwidth issues that are coming into play. And the second thing you're seeing is some of you may have seen very visible healthcare companies talking about we're going to handle copays. Don't worry. Deductibles are already accounted for. So what really that did was, in a time of a lot of uncertainty, payers stepped up. Humana, for example, stepped up and said, hey, we are going to cover copays. And I think that was important because it took a lot of concern away from people is who's going to pay for this testing? How's that going to work? And then also cultural awareness, a lot of changing just across the people's lifestyles, across how people were interacting and how people were getting work done. And so it was a significant change for payers who were mainly an office environment type setup. If you think about providers, that's a whole nother view of things that Jamie talked about. But from a provider perspective, you have significant impact and volatility in your demand. So frontline demand, you had a lot of increase in concern regarding, the COVID treatment itself, shortage of supplies. So you had supply chain issues where in the past with a real-time supply chain, in some cases weren't adequate to have enough supplies to handle a big spike in demand. So we saw that, as you saw, both visible from, states, local, hospitals themselves trying to find supplies and prepare for the volume volatility. And from a solution provider standpoint, all of a sudden realizing that solutions have to be flexible, they have to be aligned to industry requirements. And as those industry requirements are changing faster and faster, then those solutions have to be configurable, they have to be flexible enough, and that started to really bring some significant impact. At the same time, solution providers, a lot of resources at healthcare companies are coming from solution providers, and some of those, especially offshore, they weren't working from home, they aren't set up from home, they don't have laptops. So you had companies going out getting thousands of laptops and procuring those laptops just to staff up to handle the demand and the flexibility required. So that's kind of an overview of the recovery and resolve in Horizon 1. Jamie, can you talk about Horizon 2?
Absolutely, Tony. Thanks. So Horizon 2, right? Be first and resilient as you work through and try to position yourself competitively and then just competently, right? And ultimately, right, what you're working on in Horizon 2 is right the next one, whether it be the next surge or the next COVID-20. You see a discussion here, right, wrapped around, okay, how do we fix all of what we just learned, right? And then how do you position yourself to survive and then compete in the new normal or the new future? So just these aren't all, right? It's just a simple smattering of some thoughts wrapped around these next steps, right, for providers. We used to call it in the military doing after action reviews. So whenever you had a battle, right, you'd go to learn quickly with an after action review and move on to your next fight. Providers, right, in the competitive advantage spot, right, supply chain improvements and connected environments, right, with real-time status. Folks are probably still scrambling around right now trying to, put together COVID-19 tracing apps and follow up with those that have successfully recovered, and you name it. On the payer side of the house, right, automating processes that can be done very quickly, right, to help you scale with the surges that you may be dealing with. And then payers and providers, right, obviously having a cost out effort, right, to fund the new future. A lot of you are probably working through this right now. From the solution provider perspective, right, having access to these apps from anywhere would be incredibly helpful, right, in this sort of world. And then all the other potential client requirements coming out of those after action reviews are going to be incredibly important. And then finally, right, in the new normal, in the new future, getting positioned to really be able to compete with innovative and flexible solutions, because there's a whole lot of change coming out of this, right, whether it be regulatory or data sets or processes or you name it. Bob?
So I have the pleasure of taking one of the more provocative slides when we start to look at what the future is going to look like and start to do some predictions around how we see this industry is going to be permanently impacted. So eventually, we're all going to come out of this COVID-19 environment and we're going to be into the new future. And ISG sees the new future for healthcare to be significantly different than it was 4 months ago. Some of the trends were underway, but again, we see the disruption that's occurred over the last few months as driving the behavior for the future, and healthcare will not be the same in 2021 as it was in the beginning of 2020. You'll notice along the first prism right next to Horizon 3, we did not use the term value-based care. We went more generic and said value of care. One of the emerging trends over the last few years has been value-based care, and it's been universally, for the most part, universally accepted throughout the industry as a good trend. But when you look at it in the terms of a pandemic, obviously you start to see that value-based care is not the only means of moving forward into the new future. So we do think healthcare will change forever, and some of those changes we view are going to be more positive. There's going to be more digital applications. There's going to be greater use of web-based applications. There's going to be more applications on the cloud. Patients and members' expectations are going to change forever. We're going to expect more of a retail-driven consumer, if you will, that is demanding new and different applications and more convenient ways to be treated. The handoffs within the healthcare system are not going to be the expectations of our patients and members as we move forward. The ecosystem is going to change forever too. We see more and more players coming into the ecosystem. We'll talk about this more later as we look at the introduction of tech giants into our industry and how that's going to forever change things. Your ecosystems are going to change too. There used to be handoffs between payers, providers. There was a term we would always use called PBMs also. Those are going to start to morph. we're not necessarily completely bullish that there's going to be a lot of M&A activity, but we do see more and more business combinations and consolidations where you're going to have to figure out how you can influence and how you can work with these new alliances. What does it mean for your projects now? Your projects are going to look different. There's going to be more of a patient-oriented focus to them than there has been in the past. Conversations you're going to need to track. You're going to be talking to different business partners as you move forward. And the impact on your organization, obviously, will be tremendously robust. So with that, I'm going to turn it over to Jamie, who will go a little bit more into depth on what we're seeing with the providers.
So moving into Horizon 3 with the providers, and we'll cover the payers and the solution providers here in a minute, but moving into Horizon 3, the title of this slide, Embracing Patient-Centric Digital Solutions That Will Also Yield Cost Efficiencies. It is not a false choice. We do see proactive providers being able to do both at the same time, and to drive these digital solutions and cost, and which then, in if you do it correctly and well, not easy, but it is possible, right? You'll also derive those cost efficiencies. So we took a look at three different areas of doing this, and it's in the operations, the ecosystem, and the governance and risk. And these are the areas that we thought were critically important for hitting Horizon 3, right, and being competitive and operating well in the new future, the new normal. On the top there, the operations example, patient self-diagnosis. So here's where I get to tell my story. So over the weekend, doing a lot of yard work, got a lot of stuff in my eye, and tried to clean it out and make sure I was not having any sort of an issue. It was cutting the lawn and that sort of stuff, and I'm here in Texas, so there's lots of allergies and stuff. Well, obviously I didn't do a good enough job flushing my eye out. Well, about 3 o'clock in the morning, I woke up, and it felt like someone had opened my eye and poured a bag of sand dust or sand in it, and it wouldn't go away, it wouldn't stop. So obviously I was in a lot of pain. So I got up, and after trying to figure out what was wrong with me, I went to my optometrist, tried to look him up on Google, and went in there and clicked on a telehealth solution associated with him. And within about an hour, not even, I was able to have a virtual meeting with him about 9 o'clock that morning. And he and I self-diagnosed what was wrong with me, whether or not I had something actually in my eye or if it was something different. And based upon my previous interactions with him, I was able to literally have an antibiotic in my eye within about an hour and a half, and I was feeling much better rapidly. Now, it wasn't a perfect system or process. He still had to try to find me in his system, which he couldn't do, yet I had just visited him a couple of years ago. We had to coordinate with various different, pharmacies and whether or not they had the drug, and then I had to go and get the drug, and the call didn't go over there on time and that kind of stuff. But literally from 3 o'clock in the morning until 11:30 a.m., I had a solution, and I'm blessed enough, and this system worked well enough. But these are the kind of digital solutions that we're talking about. In regards to Horizon 3 and the ecosystem, obviously there was an ecosystem engaged in the story I just told you, and there's very complex ecosystems in providers' worlds. Just look at the picture there to the left. Well, that whole ecosystem review, right, what we're suggesting is, do you have the right folks, right, around your circle or in your ecosystem? Do you need to re-emphasize some and de-emphasize others, add new, that sort of stuff? We're suggesting that you do a really good ecosystem review as part of a Horizon 3 effort, right? And making sure that you're aligning yourself with the right capable solution providers to move into the new future. And then finally, you heard me talk about all the changes that are coming. There are lots of solutions and architectures out there, IT architectures, application architectures, business process architectures that allow you to be very adaptive and make rapid changes. And what we're suggesting is that as all of this change happens and rehappens and happens again, as you move from Horizon 2 to 3, we're recommending that you achieve systems and architectures and solutions that are very adaptive to all sorts of changes, whether it be scale or regulations. I'm going to turn it now over to Tony. If you could go through the payers, Tony.
Sure, Jamie. Trying to advance that slide. Here we go. So payers, one of the things recently, David Cordani, CEO of Cigna, came out and said, there's a need for greater levels of differentiated value in the marketplace. I think that encapsulates a lot of the thinking that's going on here, in that how can you differentiate yourself? And we categorize things for the new future into 4 areas for payers. First one's workforce. And if you think about workforce, we already talked about working from home and some of the changes that are going on there. But really, even before COVID, there was a critical access to talent. And talent meaning that as you're moving to a combination of onshore, offshore, and nearshore, where can you get the best talent? And moving into digital, you're looking for a new kind of talent. You're looking for people with industry knowledge, creativity, not just technical talent. And that's really playing out. And so you're seeing a lot of that happening, looking for that T-shaped digital knowledge employee as opposed to more of a specialized person. And as that's happening, at the same time, you're looking for taking those lower value tasks and automating those as much as possible. And as you automate those tasks, then you can shift your workforce to more of a focus on digital. And that's been one of the real values that have come out as companies try to differentiate themselves to more of a member-centric perspective. When you look at operations, really the acceleration of digital transformation has been key. And as we talked about member-centric, just mentioned that with digital, some of the things that you're seeing like IoT for example, so payers are trying to be as proactive as possible. And so think about this: if you're a member, a lot of you are probably wearing Fitbits or different kind of, say, Apple Watches, and that's producing a lot of data about your health, your fitness. But there are also tools out there from an IoT perspective that are allowing payers to be able to track the health of their members and to see if anything happens where you see, well, this particular member has a change in their weight from day to day. And that change in weight could be a diagnosis of a bigger problem that might happen, so they can proactively talk to that person and say, hey, we've seen a trend. Those kind of proactive digital relationships are making more of a life cycle perspective of the member as opposed to a transaction or a claim. It's becoming more of a member-centric perspective. And I think that's been a real improvement, but that's requiring a lot of change in the way that systems are done. If you move into the ecosystem, both Bob and Jamie talked a lot about the ecosystem. And really, it's how does that ecosystem work more efficiently? Bob mentioned a white paper we have on our website. I would really encourage you to go look at it because it does focus on automation in the payer space. But there are so many areas in the payer space that are really just begging for automation. And automation, claims, enrollment, a lot of the things that do touch the members, those areas that can be automated, which again allow your people to focus on significantly higher value items and more specialized care and more specialized treatment for the members is really higher value, which goes back to that differentiation that David Gordani talked about. Along with that, you have significant changes in regulations. As you saw the White House changing and speeding up approvals and FDA and all kinds of health-related regulations in COVID. Well, going forward, some of those regulations may stay as they are or even become accelerated. So it does change the way you can adapt to those things. And then we've talked about working from anywhere, but as we all know in this industry, the sanctity of data and regulatory areas around HIPAA, that security is critical. So having that security in place to work from anywhere is really important. So I want to talk a little bit about healthcare solution providers, the other triangle in the ecosystem, if you will. And again, if you move to this preparing for the new future, this is really where a crux of a lot of the solution development and systems happen to provide that innovation, the disruptive solutions as you move towards that digital kind of approach. And so again, we've separated this into some categories. The first one, and I think the most important, and probably the area where you see the most friction between parties in the ecosystem, is in innovation. And innovation, we have an item on our list that we talk about moonshot solutions. Who's going to be the first to differentiate themselves with some solutions that can have a significant impact in the market? And those areas where you can be a real game changer. And so we're seeing the battle for those kind of solutions. And in a lot of cases, it's partnerships that are formed to do those moonshot solutions. Disease to antigen. So you're seeing a case where participation across the ecosystem to solve problems. We're seeing that with COVID, and we think that's going to be something that continues to go on. And one of the other areas of innovation that we haven't talked too much about today, but we're going to start talking about later, is the hyperscalers. So as most of you know, the announcement with big tech, and you have Apple, you have Amazon, and other players getting it, Best Buy, getting into the healthcare market. And that disruption is causing a quake among everybody in the ecosystem, wondering, well, how are we going to respond to that? What does that mean to us? And that's really affecting the solution providers and having to up their game from an innovation perspective to handle the new disruption coming from the hyperscalers. If we look at operations, we've already talked about the digital solutions. Well, the solution providers are at the core of a lot of those digital solutions. Are those going to be adapted? Are those going to have the impact that the clients are looking for? And it's really a lot about flexibility, because can you have the flexibility to provide configurable systems that will be maintained over time? Because a lot of this ecosystem is filled with parties who have legacy systems, and those legacy systems are difficult to change. They don't adapt well. So new systems that are more configurable will make a big impact. And then going back to the ecosystem, we've talked a lot of, everyone here on the call, you guys know about the difficulty of the interoperability across the ecosystem. Data formats, for example, and that goes back to the hyperscalers, because if you think of the hyperscalers, one of the big advantages is if you control the data flow, you suddenly have access to data, analytics, proactive services, and things like that, that in the bigger ecosystem, when you're dealing with different formats, et cetera, that can present a significant challenge. So solution providers who solve that challenge are going to have a big advantage. And then we talked about governance, but how can you adapt to the unpredictable regulatory requirements? And I think you'll see that, again, the winner of that, the one that can really adapt, is going to be the one that's most successful. So I want to turn it over to Bob.
So we're going to switch gears just a little bit, and we're going to talk about our top 10 steps to the new future. And before we do that, I just want to introduce this with a quote from Bruce Broussard, the CEO of Humana. It's a pre-COVID quote, but I don't think it could be more apropos if he had realized the changes that would occur with the disruption. So Bruce said, health should be easy. The good news is that through the increasing use of mobile devices with their real-time networking capabilities, and by addressing health collaboratively in our communities, we're accelerating the democratization of healthcare. Might not have said it as smoothly as Bruce did, but I'm sure you get the point. The ecosystem in healthcare is changing and will change forever. And we see a way of looking at this in what we've dubbed the ISG 10 steps to the new future. So first, immediately execute cost takeout options. As was said earlier, we see a little bit of haphazardness to how some of our clients are going about this. They're addressing labor first. They're doing 20% reductions of labor forces in certain providers that you can read about on publicly available information. There's a lot of that going on. We'd like to see a more systematic approach where providers start to look at non-labor related cost takeout. So for example, is your network optimized? Have you done everything you can from a software licensing perspective? There's starting to be some interesting discussions around shredding underperforming non-strategic assets. So as many of you know, this is a common thing to do in industries outside of healthcare, but we're starting to see an emerging trend where clients are looking at their captives or captive solutions for back office functions offshore, something that they want to be in business for. They'll look at their IT department. Can somebody else run their IT department in a better way? And maybe that they can sell that IT department in consideration for services over a longer period of time. Leveraging digital labor. It started to be an emerging trend over the last couple of years in healthcare. We see more and more of that occurring in both payers and providers as we move forward. A lot of attention's been paid to the supply chain, and we won't drain that in too much detail today, but obviously providers needed to do what they needed to do when they were on the front lines and purchase PPE in whatever way they could get it, but that wasn't exactly an optimum supply chain model. So as they look to the future, they're going to have to start to have those sorts of considerations. That's what we consider the bounce back items. Moving on a little bit and starting to think about the planning for the immediate future, we see a couple or a few trends starting to take place. So you need to look at your digital strategy. Digital strategies are common in the payer space, less so in the provider space. And again, think about your ecosystem. Don't think about doing everything yourself. Don't think about solving your challenges strictly through M&A. Think about expanding your ecosystem and bringing in and embracing new players in the system like big tech providers that were mentioned earlier. You're going to have a new operating model with Industry 4.0 practices. It's inevitable. The operating model tomorrow is going to be different than it was before COVID came on. Build enabling systems. Look at your EHRs. Are they really suiting your purpose? A lot of the providers obviously have a lot invested in their EHRs. How did they stand up through the pandemic? Did you get all the information that you needed? Do you have the information to report COVID-19 related costs as you need to do to make some government claims? If not, what are some complementary systems that could be better utilized to help in that area? Cloud is going to become a way of life. The payers, the larger payers anyway, have all embraced a cloud-first strategy to one extent or the other. It's commonplace. I think those migrations to a cloud-first strategy will only get accelerated. The providers will now start to have to consider what the cloud means for them, and is there more flexibility in the cloud than they have in their current system. Last but not least, you really need to think about the new future, and we cannot stress the importance of organizational change management enough. We see the companies that succeed when there is major disruption as being the ones that have really addressed organizational change management. So even if you've developed the most robust digital operating model, you've built the best apps in the world, if you don't train your people properly, if your internal folks don't understand the new operating model, you will not be as successful as you otherwise will be. And your governance is going to be a little bit different than it is today. The new ecosystem is going to have different challenges. So you'll need to adapt your organization as you develop this new ecosystem and make sure that you've got the governance to do so. So hopefully you were paying attention as I quickly ran through these elements and started to formulate in your mind what of these top 10 are most important to you, because we're going to transition into a poll question and canvass the audience to see where you are in this particular development of the new future. So with that, I'll turn it over to Jillian, and she'll introduce the next and final poll question.
Thank you. I did just launch that. We would like 3 answer options from you guys. No more than 3, please. The question is, which of these top 10 are most important to you and your client? And everyone will have about 30 seconds to submit their answers.
While they're doing that, I wanted to remind everybody, if you want to submit questions, then on the left side of your screen, you have a blank area. And after the poll, we're going to be doing some Q&A. So we've already got some good questions coming in, but feel free to submit some questions for us.
So we'll allow a couple more minutes before Tony interprets the results to the poll questions.
Sure, we're getting a lot of good responses in. So, one of the things when we look at these 10 items, it's interesting, different perspectives, and it's a little bit tough because of the diversity of the audience on this webinar, but, it's one of those where it'll be interesting to see kind of where we saw this. And we were looking at it from the perspective of different groups might have different areas. But so let's look at the results. Have you seen, Jillian, you want to send out the results?
Yes, just sent those to everyone. You should see that pop up on your screen. It looks like our top answer is A, which is immediately execute cost takeout opportunities.
Yeah, so if you look at, that's something coming in around 46%. Probably not unexpected. I mean, and it's one of those areas where especially maybe hasn't been prevalent in the provider space. We're seeing that now. And that's going to have to be something in the new normal. Even as we talked about supply chains and those kind of impacts, you're going to see cost takeout. And I think Bob and Jamie both talked about cost takeout is also relevant to impacting digital and funding digital. Some other high areas, we had leveraged digital labor. So the automation piece, again, that's coming up higher, about 35%. And then as you can see, accelerating digital strategy and thinking ecosystem. That's another one we thought was going to be a pretty heavy hitter, so that's consistent with what we expected. And then let's see, coming in around 35% at H, accelerate moves to cloud and platform. So again, great feedback. It's interesting that probably the lowest one came in as governance, and that's a little surprising in that we typically see governance as one of the areas that needs improvement. So, but we'll see how that goes. So let me turn it back over to Bob for Q&A.
So we have a number of questions in the queue. We'll do our best to get to all of them, but if we don't answer your question, of course, we will do so after the webinar is over. But first question coming in, we'll take it from both a payer and provider perspective. So first question reads, how do you see competitive advantages changing in the future? Tony, would you like to handle that from a payer perspective? And then Jamie will discuss it from a provider perspective.
Sure. From a payer perspective, changes in the future, I think you're going to see, that digital kind of member-centric relationship being stronger, and whoever controls that the best is going to have the best client and member, stickiness. Probably less movement from place to place, but a lot of key relationships there with between the member and the entity. A lot of that is driven by digital. So I think that digital first, you're seeing most of the payers embrace that kind of perspective from an executive level, which is different than before where IT was pushing that. You're seeing a lot of that coming from the business and the executive ranks.
Jamie, how about the providers?
Yeah, so those that can figure out, and many of us are starting to experience some of the providing of healthcare, right? Whether you have an Apple Watch sitting on your wrist or some other device plugged into yourself, or your experience, right, is informed, it's fast, right? It's context aware to you. It's very data informed, right? We all know that all sorts of data is becoming more and more important, right? Just the conversation wrapped around social determinants of health. Whatever provider, end to end, right, from disease to antigen or injury to cure, whatever ecosystem of providers that can pull all that together so that patient-centric experience is had and obviously advertised and known, right? We all understand network effects, right? Hey, wow, this provider-payer combination is so much better than the other. So whoever figures out that smoother end-to-end life cycle of the patient, with all that's available to us now, right? It's there. It's a matter of execution at this point in time. Granted, there's some new regulatory things that are going to happen to us and that kind of stuff, but the capabilities exist. It's really getting rid of the old, right, in a smart, sensible way, and bringing in this new operating model, and pulling all that together. So whoever figures that out, I think it's going to be in really good shape. Bob?
Okay, next question. Have you seen a growing synergy between public sector and healthcare providers, i.e. cities collaborating with healthcare providers? If yes, do you see an area of permanent collaboration? How can solution providers help build support and accelerate these synergies? So Tony, you want to start us off, and then I'll add some color too.
Yes, I think one of the areas, Bob, that you might see this cooperation going forward is in the supply chain. And the reason I say that is, we had a lot of kind of back and forth about, well, who has ventilators? Who has this supply? Who has that supply? And amazingly, it seemed like at the end of the day, people came together and said, well, how much do you need? Well, let's share those resources across entities, whether it's within a state, whether it's across cities, whether it's across country, and from a federal perspective. And so I think that might be something where, to solve the supply chain issue, maybe there's a way to have a little bit more flexibility built in. And then I think the second part of that would be the cooperation that happened just regarding hospital to hospital and provider space was really amazing to see. And I think you might see more and more of that kind of work where, if you have overflow, how can you handle that from place to place? So that's one thought.
I'm not going to let you answer the question first, Tony, because that's exactly what I was going to say. Not much to add to that, other than to reinforce that I think this is permanent. We don't expect that this will go away. There's been a lot of benefits to this level of collaborations between cities and states and healthcare providers, and hopefully it will continue into the future. We think that's a positive development that should continue. Moving on to the next question. What is the COVID-19 impact on healthcare information technology companies like Epic, Cerner, and Allscripts? I'll take the first response to that, and then I'll let Jamie add some color. So I won't comment on any individual company. I don't think that's appropriate. But what we are seeing across the genre, if you will, is a necessity to look at their solutions and develop a little bit more flexibility. So there are a lot of demands coming out of the providers, and for that matter, the payers too, that affect companies that we dub as healthcare solution providers. And the flexibility of those systems is coming under scrutiny. So as they look to evolve their specific solutions, we're going to look for more speed on their cloud first initiatives, on their transformations to the cloud. We're going to look at ability to get out patches and releases more quickly. We're going to look at their capabilities to be more patient-centric and develop lessons learned from other industries like retail. So, Jamie, you want to add anything to that?
Yeah, I would equate it to what has been the impact of Apple, Google, Amazon, Microsoft on similar compute platform players or something to that effect. The need to accelerate digital models, right, and scalable models and cloud-based models is obviously there, right? So whoever can do that in a scalable, cost-effective, efficient, right, data interoperability kind of a role, that's going to be the impact. So the pressure's on. Some of the information technology companies, right, are having more and more competition, not only in this market, which has tons of money in it, right, but also now to react to the COVID-19 impacts, right? And each state and each provider or payer is going to be demanding different things. So it's going to be tremendous. So the healthcare solution providers, this is clearly a point in history where they're either going to step up or really struggle in market.
Thank you, Jamie. Oh, next question coming in. Oh, I like this one. Historically, the providers have not been known for being cost conscious. You mentioned that this is changing during the webinar. What do you see as the main areas where they will be cutting costs in the near and midterm? So this is a great question because what we're seeing in the market on providers is kind of an approach to cost cutting that we would not dub as overly mature. They're looking at labor first and doing some very broad-based cuts around labor to account for their profitability shortfalls. We see more opportunities for them in looking at non-labor related costs, as we said during the webinar. So hopefully as their approach matures, we'll see a little bit more robust methodology for how they go about cost takeout rather than what we're seeing in the space today. So next question, I'll give this one over to Tony. What are payers doing to differentiate themselves? Tony, you want to give some comments on that?
Yes, I think one of the big, if you look at the touch points, a lot of payers are starting to do things like design thinking where they look at the journey maps of the members and say, how can we better interact with members? I mean, how many people enjoy the claims process, right? So most of the time, I think what you're seeing is the making things as efficient as we talked about automation. How can you make that as efficient as possible? And then the second part of it is, how can you build the richness between that differentiation? If you remember, from Cigna, they talked about how can we differentiate value. And I think a lot of that's coming from, if you look at Humana and a lot of their, digital first interaction with the member and using technology and data to be proactive and being really involved through the whole cycle of a person's life, then I think that's where you're going to see the differentiation across these parties and who can shift from the legacy systems to more adaptable systems faster.
So my apologies, but I'm checking the clock. We only have time for one more question, and we still have several in the queue. So I'll pick this one. What are some of the lessons learned when embarking on a new operating model design? Jamie, you want to handle that one?
Yeah, sure. So obviously the new operating model, right, that includes all sorts of things from governance to the technologies you're going to use to the culture and the talent engagement, right, the organization, the teams, the roles, the workflow, the services, the value and performance, right? Those are all the components of the operating model, but really making sure that it's aligned to the strategy of the organization, right? And then as you go to change this operating model, right, organizational change management, which we saw did not get a lot of first votes or top critical votes there in our poll earlier. That organizational change management is huge to making sure that it's successful, right? You get the value out of the change and that sort of thing.
Thank you, Jamie, and thank you to all that participated in the webinar today. We will make the slides available, and we will also make a rebroadcast available for those that are interested. And Jillian, is there any other closing comments that we should conclude with from your side?
Thanks, Bob. Yes, this does conclude our time today. We appreciate you joining this ISG Smart Talk. As mentioned, the recording of this webinar will be available to share with your colleagues at the same link as the live event. You can also download a PDF of today's slides in the Event Resources section. If you would like to speak with Bob, Jamie, Tony, or any of our ISG advisors, please reach out to us at www.isg-one.com. Thank you for listening.